Adab Sanover from Gets Pharma and welcome to our today's session. आज हम लोग जिस टॉपिक पे जिस चीज़ के ऊपर बात करने जा रहे हैं वो बहुत इम्पॉर्टेंट है क्योंकि इस वक्त पेंडेमिक सिचुएशन के वक्त हम लोग बहुत सारी ऐसी डिजीजेस हैं, ऐसे प्रॉब्लम्स हैं जिनको हम इस वक्त नहीं इनकाउंटर कर रहे हैं और वो बहुत इम्पॉर्टेंट है उनके बारे में जानना और उनको डेली लाइफ में किस तरह से डील करना है उसके लिए भी बहुत ज़्यादा इम्पॉर्टेंट है. So today we will be discussing on the hip fracture and osteoporosis, and for that we have a very academic professor with us जो कि हमें इस पूरी disease के बारे में इससे सारे जो problems हो रहे हैं उसके बारे में बता रहे होंगे. He is none other than Professor Dr. Riaz Ahmed. He is the Dean Orthopedic Neurosurgery and Trauma, Head of Orthopedic Department of Rawalpindi Medical University, Rawalpindi, Pakistan. So I'll forward this session towards Professor Riaz Ahmed. Assalamu alaikum, sir.
जी वालेकुम अस्सलाम. I hope everybody is listening to me.
Sure, sir.
मैं वेलकम करता हूँ अपने सारे दोस्तों को और अपने कोलीग्स को on this academic forum. जैसा कि सुनोबर ने बताया कि very difficult time is going on और हर बंदा ही इसमें मसरूफ़ है और स्पेशली मेरे जो फ्रंट लाइन जो है हमारे सोल्जर्स डॉक्टर साहिबान वो सारे इस वक्त मेरा ख्याल है जिस परेशानी में और जिस मुश्किल में हैं ये वही बेहतर समझ सकते हैं, उसके अलावा कोई और उनको बेहतर नहीं समझ सकता. मेरा ख्याल है दिस इज़ द हाईएस्ट टाइम इन आवर प्रोफेशन जो लाइफ टाइम में एक दफ़ा ही किसी के आता है. दिस पैंडेमिक इज़ गोइंग ऑन एंड मोस्टली जो है हमारे लोग वो इसको सही तरह समझ नहीं पा रहे. आज मैं शुक्रगुजार हूँ इनका गेट्स फार्मा वालों का कि उन्होंने इस टेंशन वाले टाइम में, इस हाई टाइम में एक एकेडमिक फोरम का एहतमाम किया और दे हैव अरेंज दिस जस्ट टू गेट जैसे कहते हैं ना रिलीफ फ्रॉम द टेंशन और टू बी इन टच इन अवर प्रोफेशन. जैसा कि सारे देख ही रहे हैं कि हम लोग मोस्ट ऑफ द हॉस्पिटल्स दे आर कन्वर्टेड इनटू कोरोना हॉस्पिटल्स और हमारा हॉस्पिटल भी जो है बेनजीर भुट्टो हॉस्पिटल वो सारा उन्होंने कोरोना हॉस्पिटल में कन्वर्ट कर दिया और हम इस वक्त सिर्फ और सिर्फ एमरजेंसी जो है ऑर्थोपेडिक ट्रॉमा और बाकी चीज़ें ले रहे हैं और बड़ा ही डिफ़िकल्ट है कि पेशेंट्स को लेना. और जैसा कि आपने देखा ही है कि लॉकडाउन को सही तरह फॉलो नहीं किया गया तो ट्रॉमा का जो है रेशो वो और इंक्रीज हो गया. अब इसको सारा हैंडल करना आई नो कि हमारे ऑर्थोपेडिक कोलीग्स कितनी मुश्किल से ये सारी चीज़ें देख रहे होंगे. बहरहाल हम ये थोड़ा सा टॉपिक डिस्कस करेंगे हिप फ्रैक्चर्स इन ऑस्टियोपोरोसिस क्योंकि ये पेशेंट्स जो हैं आजकल और ज़्यादा डिफ़िकल्ट हो गया है ऐसा ट्रॉमा जिसमें हमें इमेज इंटेंसीफायर और स्पेशल गैजेट्स की ज़रूरत होती है. तो हम थोड़ा सा इसको डिस्कस करेंगे और फिर उसके बाद अगर सारों ने अपने व्यूज़ शेयर करने हुए तो वी वुड लाइक टू शेयर दैट. सो वी स्टार्ट टुडेज दिस program, hip fractures in osteoporosis. As everybody knows that osteoporosis accounts for more than 1.5 million fractures annually and almost 300,000 hip fractures and 700,000 vertebral fractures and 250 wrist fractures and 300,000 fractures at the other sides. This data we collected in the past about 15 years in all over the world. And the osteoporosis, what is the definition? A systemic disease characterized by low bone mass and microarchitectural skeletal deterioration with a consequent increase in bone fragility and susceptibility to fracture. And BMDT score 2.5 SD below the mean peak value in young adults. This is the WHO criteria. And as we know that 1 in 2 women and 1 in 5 men over 65, they sustain bone fractures due to osteoporosis. And you can see the normal bone here and the osteoporotic bone in which the trabeculae, they are apart from each other and the bridge system is not there. Osteoporotic fractures in women compared with other diseases. If we compare the osteoporosis with other diseases like heart attack, stroke, and breast cancer, you can see the number of patients of osteoporosis that is more as compared to the other diseases. That's why everybody was working on it, and to reduce this huge burden on the economy and on the health system, they were working on it. And fractures in the elderly, the incidence of hip fracture was more in the elderly people, as you can see on the slides. And this is the overall man and woman comparison of both the hip fractures. Most common treat fractures with respect to osteoporosis, as जितने मेरे जितने orthopedic colleagues हैं, उनको तो पता है इस चीज़ का कि mostly जो hip fractures हैं वो हमारे पास आते हैं. और हमारा वार्ड जो होता है मोस्टली अबाउट all over in Pakistan, all the centers, all the say orthopedic surgeons, almost 70% जो होता है patients वो hip fractures के साथ हमारे पास present करते हैं. And you know that they require surgical intervention. और सर्जरी के अलावा इसमें कोई भी इंटरवेंशन दैट इज नॉट रिकमेंडेड. ये इसमें हम सर्जरी क्यों करते हैं जल्दी? फॉर अर्ली एम्बुलेशन ऑफ द पेशेंट, कि पेशेंट की अगर आज सर्जरी हो जाती है तो नेक्स्ट डे वो पेशेंट अपना वॉकर के साथ या टच डाउन वेट बेयरिंग के साथ वो मोबिलाइज हो जाता है, और जो रिस्क है उसका मॉर्बिडिटी का वो डिक्रीज हो जाता है. और जैसा कि आपने देखा ही है कि अगर पेशेंट बेड रिडन हो उसमें चांसेस ऑफ comorbidities they are more, as you know that the pressure source, the renal failures, the chest problems and the other problems, they increases if the patient is lying in the bed. And we know that the estimated cost on an average hip fracture is 80 to 150,000. This is for one patient per year. A 50 years of old woman's lifetime risk of dying from hip fracture is equal to her risk of dying from the breast cancer and greater than her risk of dying from endometrial cancer. This is a comparison कि जी hip fracture को breast cancer और endometrial cancer के साथ comparison किया हुआ है, that the rate is almost equal in the other diseases. This is degree of dependence, कि अगर किसी का कोई fracture हो जाए तो उसकी degree of dependence किस तरह से low हो जाती है, कि अगर if there is a hip fracture, the dependency on the others that increases. Vertebral fractures, which is a very painful fracture as well. In this, the patient mostly the bedridden and the dependency on the other persons in the family that increases. Forearm fracture, the patient is mobile most of the time, that why the dependency is low. This is cervical after hip fracture. When it was calculated that if a person gets hip fracture and the survival per year that decreases, mostly the people they die within 1 year. This is because the comorbidities they increase and the life expectancy is reduced in such patients. This is the age in specific incidence of fractures. Men and women, they are compared, and this is the different thing you can see. Now we come to the with the hip fractures, percentage of patients receiving treatment from osteoporosis of hip fractures. If they are getting the treatment after the fracture, then the chances of refracture that reduces. So if we are managing these patients at the time of discharge, we should try to give proper medicines, which we will be discussing in the later slides, that if these medicines they are prescribed, then the rate of refracture that reduces. This is the low trauma. This is also called the fragility fractures. Just hold the screen. This you can see that any fracture since the age of 50, 1.5, 1.9, or risk of self-reported spinal fractures that increases. With women's age 60 years or more, the fragility fractures that increases. With a trivial trauma, very low trauma, the fracture is there. This is a burden of osteoporotic fractures worldwide. This is calculated for almost about 100 years, और estimated जो fractures हैं उसमें कि जी up to 20 to 50 कितना उसका increase करेगा. और इस slide में you can see in Asia the number of patients that is increasing because the rate of osteoporosis that is also increasing, as mostly the people they are not getting the anti-resorptive medicines or the medicines for the osteoporosis. So if they are not using these medicines, if they are not caring about their bones, then the ratio of these fractures that will increase. Fracture, what are the risk factors? Risk factors are the low bone mineral density, prior fragility fracture, age, family history of osteoporotic fractures, and tendency to fall. These are the risk factors which cause this. And this is also the aging, menopause, increased bone loss, other risk factors, other comorbidities that they add up to the increased bone loss, and increased bone loss leads to low bone density and ultimately to the fractures. In this slide, you can see the structure of the normal bone and bone in the osteoporosis. And this was taken from the hip bone. I hope everybody is comfortable till now and my voice is clear.
Yes, sir, we can hear you.
Okay, thank you very much. I hope the other participants, they are also comfortable.
Yes, sir.
Oh, great, great. So how to diagnose this disease? You can see that the best diagnosis of the osteoporosis is the DEXA scan, dual X-ray absorptiometry. These machines, they are not available in the big cities and also in the smaller cities now. In the past, there were few machines, one in Karachi, one in Lahore, and now you can get these DEXA scan machines everywhere in our country. This is a good thing that our patient is properly diagnosed properly, and now the awareness of this disease is also there. In the past, the awareness was very low, and the women after the menopause, they were not taking care of their bones, and the fracture risk was more. And BMD and the fracture risks are irreversibly related. If the bone density is decreased, the rate of the fracture that will increase. So if the patient or the person or a woman, she comes to you with the postmenopausal age group, normally the signs, symptoms, the pains and aches in the body, and she's lethargic, she's not fit. And if you ask her, when was your menopause, she will tell you that was there after in 2 years or 5 years. So the first thing after examination is you ask for the investigation is the DEXA scan. These and in the DEXA scan, we get the bone density of the lumbar spine, of the vertebrae, of the hip, and the wrist joints. These are the three common sites of the fractures. Now we come to the treatment. There are few drugs which are very important in osteoporotic fractures and osteoporosis. These drugs, they are only for the osteoporosis. But at times, when we discuss these medicines, the controversy starts that if a fracture is there, either we should use the bisphosphonates or not. We'll discuss later on in the question answer sessions. But these are the few drugs I have tabulated for a common use of our, say, general practitioners and our colleagues. The drugs, they are bisphosphonates, that is calcitonin, that may be hormonal replacement therapy, which is called HRT, or teriparatide, osteo injections. These are available in the market for the better treatment of our patients. Bisphosphonates, they are available in two forms. Either they are oral form or they are in the IV form. In oral forms, nowadays we are getting tablets which are being used once a week, once a month. And in injectable forms, we use medicines once every 3 months, and which is once a year. These things, they are not readily available in Pakistan, in our country. So our patients, they are now properly getting the treatment. Calcitonin was the initial therapy which was being used for the osteoporosis. This drug is very, very important. Nowadays, it is very difficult to get this drug. Calcitonin is the very important drug to reduce the bone pain. When there is a fracture and you need some, say, medicine which reduce the pain, that is the drug of choice, which is calcitonin. Hormonal replacement therapy, this is good for the postmenopausal age group, but the chances of endometrial cancer was more in certain patients, so the use of this drug was reduced. Teriparatide or parathyroid hormone, which is the natural, say, drug, which is specially used for osteoporosis, and this is also very effective for bone pain. These are the few gadgets which we can advise to the patients that if there is history of fall, the patient doesn't get any fragility fractures. These are the hip cushions and the back cushions that they are also available. But I would like to share as well that if you have got the, we have to advise our patients that for the older people in house, they should take special measures, say in the washrooms, in the bedrooms. They should have the sports. When the patient gets up from the bed, he or she should be holding that sport and then walking. At times when in old age, the patient when stands up, there is dizziness and she falls. Or at times it is seen that the bone is already weak and the patient when he stands or she stands and the fracture is there, which is called the pathological fracture, and she falls down. So in the washroom, the slippery areas are there in our washroom. So in washrooms, we should be having some sports so that the patient when goes into the washroom, he or she should be holding those things. Now we come to the later on part, as I discussed earlier, that the hip fractures mostly need surgery for early mobilization of the patients. And we are getting, and my orthopedic colleagues and the general practitioners, they must be seeing such old ladies who are very precious for us. And these, when you see the agony on the face when they get these fractures. And these are few fractures, per rock fractures, which needs fixation and is being fixed with dynamic hip screws. Now the latest gadgets, they are there. And if there is a neck femur, we can replace the femoral component, which is called osteomur. In the past, it was being used. And nowadays, the bipolar prostheses, they are available. And most latest things, they are being available in Pakistan, and our patient is getting benefit of this. This is a patient with degenerative arthritis, and there may be fracture neck of the femur, and later on she needs total hip replacement. And this is a cemented type of total hip replacement, which is very frequently done in our setups. This is also another patient in which total hip arthroplasty is being done. And this is a patient in which a bone cage is being used for fixation of the total hip arthroplasty. And these patients, you see the face when they get relief from the pain, how happy they are. And this is, as a doctor, as a surgeon, this is our aim, that the people, they must be very, very happy after your treatment. These are the few fractures I would like to see. And these are the implant failures in osteoporotic fractures. If you have not fixed it properly, then you can see the implant failures. In the end, I would just like to say that if the prevalence of the hip fractures continue to rise at current rates, it may well be that in the next few decades, orthopedists will do little else but treat this problem. कि हमें ज़्यादातर ऐसे पेशेंट को ही मैनेज करना पड़ेगा अगर इसका रेट ना रिड्यूस किया गया. इसके लिए बेस्ट वे यही होगा कि when we are sitting in the outdoors, we must be picking up the osteoporotic patients. We must be treating them when we are sitting our clinics. We must be picking up the osteoporotic patients, and there should be regular campaigns on the media that how to make aware the people so that they can take care of their bones. They must be involved in their healthy activities like exercises, like their say routine dietary habits. That should be very good so that the people, they are using these things and they are taking care of their bones. Thank you very much. And if there are any questions, I would like to answer those things.
Thank you so much, sir. Now we are opening the session for questions. Okay. So one of the questions we have got is that कि हर hip fracture जो है वो surgery की तरफ ही जा रहा होता है.
जी, if I am getting your question, yes, the answer is yes. Most of the time, you have to do the surgery in fractures around the hip joint.
So, leading with this question, क्या प्रिकॉशनरी मेजर्स हो सकते हैं जो कि हिप फ्रैक्चर से बचा जा सकता है इन ओल्ड एज?
देखिए, मैंने जैसे आपको कहा है कि जी, एक तो ये है कि ओल्ड एज में हमें प्रोटेक्टिव गियर्स जो होते हैं वो घरों में लगाने चाहिए, वॉशरूम्स में लगाने चाहिए। फिर यू मस्ट बी पिकिंग अप द पेशेंट्स अर्ली, कि आपने पेशेंट को पिक करना है अर्ली कि ये पेशेंट है ऑस्टियोपोरोसिस का, इसमें चांसेस हैं कि इनको फ्रैक्चर्स हो जाएं अराउंड हिप, अराउंड स्पाइन और अराउंड रिस्ट्स। सो ऐसे पेशेंट्स में हमें प्रॉपरली डायग्नोज करके उसका ट्रीटमेंट, जैसा हमने बताया कि जी स्टार्ट में आप HRTs दे सकते हो, हार्मोनल रिप्लेसमेंट थेरेपी, बिसफॉस्फोनेट्स दे सकते हो, टेरिपेराइड दे सकते हो, या कैल्सिटोनिन ट्रीटमेंट जो है वो दे सकते हो। There are different treatments available. सिर्फ ये है कि you have to pick up the patient and you have to make aware these patients that they should be treating themselves.
So हमारे पास एक और क्वेश्चन जो आ रहा है वो ये है कि मोस्टली जो पूछा जाता है वो ये कि bone fragile and osteoporosis are same things.
जी फिर बोले, क्या कहा आपने?
Sir, we have a common question कि bone fragile की जो problem है and the osteoporosis are the same diseases?
बोन फ्रेजिलिटी जो कहते हैं, फ्रेजिलिटी फ्रैक्चर्स जो होते हैं, फ्रेजिलिटी फ्रैक्चर्स जो नॉर्मली होते हैं वो होते ही ऑस्टियोपोरोटिक बोन में है। अब होता ये है कि बोन की जो फ्रेजिलिटी है, दैट हाउ इट इंक्रीजेस, देयर शुड बी सम डिजीज इन द बोन, तो उसकी वजह से बोन जो है फ्रेजाइल हो जाती है और ब्रेक कर जाती है। इसे हम कहते हैं पैथोलॉजिकल फ्रैक्चर। पैथोलॉजिकल फ्रैक्चर उसे कहते हैं जो बोन ऑलरेडी डिजीज्ड होती है और देयर इज सम पैथोलॉजी इन द बोन एंड दैट गेट्स फ्रैक्चर इजीली, so that's why that is called fragility fractures.
Okay. Thank you so much, sir. It was very informative session. Currently, I am not looking at questions any जो कि हमसे पूछे जा रहे हों regarding the hip fractures and all. I'm sure कि हमारे पास further इस session को जब live recorded version देख रहे होंगे तो हमारे पास different questions आएंगे that will be forwarded to you for your valuable answers. So anything you want to add on in the last session?
बस ना मैं एड ऑन यही करना चाहूँगा कि प्लीज़ इस पेंडेमिक में डॉक्टर्स जिस तरह काम कर रहे हैं, मैं कोशिश करूँगा, एक दो ने एप्रिसिएशंस हैं, वो तो ऑलरेडी हमारे डॉक्टर्स जो होते हैं वो ऑलरेडी हर वक्त ही इस काम में मसरूफ़ होते हैं। दे आर हेल्पिंग द पीपल, दे आर हेल्पिंग द एलिंग कम्युनिटी एंड लेकिन इस कड़े वक्त में जिस तरह का उन पे ऊपर इम्तिहान है कि किसी को इस डिजीज़ का पता नहीं चल रहा, इसलिए बड़े सब्र के साथ, बड़े तहम्मुल के साथ हमें इस महाज पे लड़ना है और इस महाज पे इंशाल्लाह ताला हम सुरखरू होंगे। मैं अपने सारे डॉक्टर साहिबान के लिए दुआगो हूँ कि अल्लाह जी वो उनको इस मुश्किल घड़ी से निकाले, उनको और उनकी फैमिलीज़ को सारों को अपनी ईमान में रखे, सेहत तंदुरुस्ती अता फरमाए और इस मुल्क बीमारी से बचा के रखे। और जो लोग इसमें मुब्तला हुए हैं, अल्लाह जी उन्हें जल्द से जल्द सेहतयाब करें और अपने ईमान से उनको बेहतर करें। बाकी मैं शुक्रगुजार हूँ आप लोगों का, गेट्स फार्मा का, कि वो इस मुश्किल वक्त में हम लोगों को मसरूफ़ करके रखते हैं और हमारे लिए हर वक्त बिजी रहते हैं। और जो भी एकेडमिक एक्टिविटीज़ या पेशेंट्स की एक्टिविटी, पेशेंट के लिए एक्टिविटी हो रही है, उसमें आप लोग पार्टिसिपेट कर रहे होते हो। आई एम रियली थैंकफुल to the team head office and our team in Islamabad, Rawalpindi, Islamabad, who are working hard for the doctors and for the patients. Thank you very much.
Thank you so much, sir. You are the heroes right now.